Welcome to the Concussion Fix podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Krynen Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
Welcome to this week's Q&A. We are happy to have everybody here. Also want to remind everyone that we are going to be in upstate New York in Rhinebeck on the weekend of July 18th, 19th, and 20th. So we're kind of giving a bit of a crash course. If you want to come out and meet the instructors, we would absolutely love to see you there. A couple of shout outs also. So we have who started the program at 90. Her symptom severity score was 90 out of 132. And in 4 months, she's already down to 30. So she's so close. She's still in the program. She's doing amazing. But just when I saw that drop, that was an amazing drop to see in only 4 months. And then started the program at 84 out of 132, and in 5 months was down to 2. So she is fully recovered at 2 and only took 5 months. So congratulations to both of them.
Yay! I love these because I just want to hear them, and I'm like, yeah.
I know, like seeing like the huge drops, even when they're not fully recovered, like knowing like you went from 90, like that's a huge score down to 30 in such a few months, and living with those symptoms for years, most likely beforehand. It gets
well, it's like at 90 you can't function. 30 you could still like be productive and live your life a little bit. You know what I mean? You're not fully comfortable, but you're able to do things. Just for context for people, is like anything below a 7 out of 132 is considered fully recovered, because that's the average of normal healthy people. So if we were to take a symptom severity score on 1,000 people in the general population without concussion, the average score would be about 7. So you're not trying to get back to 0. You're basically trying to get back to like normal, which is anything kind of around a 7. So if you get to a 2, you're considered fully recovered. That's why Nikki said that.
Yeah. I remember being at 90, and I would describe myself as a third child for my husband to take care of. I was completely useless, and like I couldn't do anything. So seeing those drops are absolutely amazing.
And look at you now, Nikki.
Right?
Look at you now.
Fully recovered over 4 years.
That's right.
We couldn't survive without you, Nikki.
Possible. It's doable. That's the amazing part. There's a lot of. It's meant to inspire people. It's meant to give people hope. It excites us every time we hear it, like Cam said. Like, it's the reason I think we do this program in the first place. And it's absolutely possible. So we really hope this motivates everyone.
Yeah. All right. Let's go to our first question with.
So this might honestly be for all three of you to chime in on. So it's been a while since the last time I was on here and talked to you guys. So real quick, I'm almost at 2 years since my injury. I have had severe autonomic dysfunction. I had autonomic dysfunction before the injury due to long COVID. And once, the injury happened, it tripled in severity. So I waited. I was on an 11-month wait list for autonomic testing in Boston, and so I finally went on April 30th, and I just got my results last week, and they confirmed, kind of like what you all have talked about is I try to explain to like my primary care and stuff, and they're like, "What are you talking about?" And now I finally have it in writing. So I was diagnosed with orthostatic hypotension. They said it was not POTS, but they said it's similar to POTS.
Yeah.
Is that true?
Yeah, it's just a different form of dysautonomia. So some people will respond by having an elevated heart rate. Other people will respond in your situation as a drop in blood pressure with changes in position.
Right. So my heart rate was fairly stable, but my blood pressure, the lowest it went when it because I did the tilt table. I failed the Buffalo treadmill test in 30 seconds, but my blood pressure dropped 25, I guess, points. They call it the mmHg. So it actually, the systolic, it went from 113 was the highest I was at. I typically have lower blood pressure anyways, but it dropped to 76 over 61
Wow.
when they tilted me up.
Yeah.
And then I recover within like they ran it again like 10 minutes later, and I had recovered. But yeah, but that's what happens. So when I get up like out of a seat, I always rise very slowly, as it is, because I get that like kind of faint sensation, though I've never fainted. Um, so clearly, they confirmed all this, dysautonomia. So, I mean, I've been in this program since September of 23. I mean, I've pretty much heard, all the different things, and I've tried them, from the diet to trying to do light exercise. And Dr. Cam, we've talked about that a couple months ago. I am extremely exercise intolerant. Like I walk with a cane when I go out. I got a recumbent bike, and while that does help with the whole blood pressure issue, it still does definitely trigger the head pressure. So I'm kind of limited to like, I do under 10 minutes at a time on the bike. So yeah, and Dr. Hrkal, for you, I did the full 8 weeks, pretty much 100% in on the diet, and I'm still to this day I'm gluten free. But I felt like I hit a plateau. So like it definitely helped my headaches, I feel like, but I don't feel like it ever did anything for the dysautonomia.
Yeah, I would agree with that in my experience. That diet has a supportive and foundational role to play, but I've never seen diet alone resolve dysautonomia in all my years of practice. I think it's helped. I think it's helped to reduce symptoms, but your nervous system, your autonomic nervous system, is dysfunctional, and the only way, and for whatever reason, it seems to be affecting like the baroreceptors that are controlling blood pressure and then ultimately blood flow in your body, and that's why it's the orthostatic hypotension. There are some, I will say though, in my space at least, and I know Melinda and Cam will comment as well. There are some hormonal aspects to it, specifically hormone replacements when it comes to adrenal hormones, both that regulate blood pressure, like for example, aldosterone and also cortisol, that play a very important role in regulating, and addressing orthostatic hypotension. So that's not diet necessarily, but that's definitely supplemental and hormonal.
So the cortisol, what was the first one you said?
Aldosterone or something called vasopressin. These are hormones that the adrenal gland produces and the kidneys. and they regulate blood pressure ultimately. A lot of blood pressure medications target angiotensin and these other hormones. So there are assessing those is one angle that can be quite helpful. But again, to your point, diet is, and for everyone listening, diet is really helpful to support it. But it's also useful to say that the Concussion Fix diet is super foundational, but there is some additional factors that, like for example, sodium, like for example, other food sensitivities that we don't talk about in the Concussion Fix diet that can be really helpful for you addressing dysautonomia.
Yeah, so I actually, just did a quick, because to what Melinda's talked about too, with the frustration with the doctors and everything, I waited 11 months for this test, and now just to go back and like discuss like treatments and stuff like that, it's another 6-month wait. So it's like a year and a half just to, just to get some answers, which is why I wanted to ask you guys. But in the meantime, like I got like electrolytes, and I put that in my water all the time to help with the sodium intake, as you mentioned, Dr. Hrkal. And then compression socks, just because I work at home, but I sit at a computer most of the day.
Right.
So, just to kind of not have the blood pool, I guess, at my feet. So yeah, I'm just looking for suggestions to
look at the screen right now. If you look at it, number 2 on the list is abdominal compression. Compression socks will do very little for anybody with both POTS and hypotension, in my experience.
So I actually have one of those.
Okay.
So because I had one of those because I had a hernia like years ago.
So it's like you have to put the socks on. You have to put the like upper thigh ones. You almost need like a full like leotard compression up to your abdomen. So that might help more. Also raising your bed up a bit, like even if it's 3-4 inches off the ground, like the top of the bed, that makes a difference. Raising the head of the bed, that can sometimes help. But ultimately, like Dr. Cam, you probably agree with this. Addressing some of the underlying things that are driving the dysautonomia, like this is a topic that's extremely advanced. We still don't know a lot about it, but it's my opinion that there is some other, I'm going to call it autoimmune process that's attacking the nerves that's causing this. Now I know that's in the literature, but it's not mainstream. Again, if we're looking at the root cause, and so over time, your body's immune system can kind of regulate. We can do with all the things on this list. It can the effect can kind of go down, and you with different lifestyle, medication, exercise can slowly get back up to it. But if we're really trying to get after the root cause, which is ultimately what we want. It takes like a really comprehensive approach that I believe is quite personalized, which is why I mentioned things like food sensitivities. So this is like the foundations, but it seems like what I'm hearing from you is that you kind of tried all the basic things and they haven't really worked. Is that right?
Correct. Yeah. I mean, like I've gone through all the program, the whole program aside. I obviously hit a wall at the exercise portion. And the rehab at the end, but every week I listen to these lives and just hear all the different things, and I've tried to implement them, and I'm autonomic wise, I'm exactly where I was almost 2 years ago. I feel headaches have definitely helped, but yeah, the dysautonomia is quite severe, and the cerebral blood flow. Per that test that I told you I had, that ended up dropping by 33% when I got lifted up. Yeah. So yeah, it's definitely a blood flow issue, and I'm looking for anything here.
Yeah, so I mean, we have to think about all the things that impact the autonomic nervous system, right? So we mentioned like hormones and adrenals, and that can be from a state of just chronic stress. Right, that you get into that type of state. So we have to do things to try and kind of calm that sympathetic tone down. So a lot of it is kind of more on Melinda's side of things, right? Like doing breathing exercises and meditation and grounding. Then we also have to think about trying to remain upright as much as possible throughout the day, right? If we sit for extended periods of time, that's going to also dysregulate things. So you might want to consider getting a standing desk, and pairing that with some compression, right? So both compression stockings, but also like you need kind of full length up to the abdomen to help with that. And then trying to remain upright as much as possible throughout the day just helps your autonomic nervous system to kind of acclimatize to being upright, right? And all that stuff helps. Fluid intake, and I'm not sure if you're already doing this, but you need to be drinking like quite a bit of fluids every day. The salt recommendation is to try and get up to 7 to 10 grams of salt, and you want to do this kind of, gradually over time. But the recommendation that I've seen is that you actually measure out what you want in salt for the day and put it in a plastic bag, and then try to finish it throughout the day so that you're having that increased sodium. So if you measure out like, let's start with 5 grams, and sprinkle it on your food, put it in your water, and do that type of thing, and gradually getting up to that kind of 7 to 10 grams per day will help. There's certain medications, so when you go back in 6 months, they may actually put you on different medications which can help, but in the time being, it's working on like muscular contraction in the lower legs to try and improve that blood flow back. Like if you're standing at a desk, doing like calf raises as you're standing, just to try and just improve that blood flow back. Right, exercise. So I have a question about your exercise. You're doing the bike, you say 10 minutes, but are you measuring your heart rate as you do that?
Correct. Because I have a band, and I just keep it running as I'm doing the exercise.
What heart rate are you at?
So my I would say my sub-symptom threshold is somewhere like in the low 90s. Once I typically hit like 100, once I go past 100, I'm pretty much cooked, because it's like I get up to that point where I'm getting that 3-point increase, in
Yep.
symptoms.
Yep. Yeah. So what you want to do is you want to stay below that for a couple weeks and then try to re-challenge it and see if that moves at all. So you want to keep kind of just working at that. It may take you a while to go. Like if you look at the Levine protocol, which is 4 POTS, but it would probably also be helpful in orthostatic hypotension. Just because it's various forms of recumbent exercise, but it also includes some strength training to get the muscles kind of working better, not just steady state cardio. And I think that might be helpful as well. If you were to look at the Levine protocol, it's in the modules, and you can start kind of going through that. But it's like a 6-month to 8-month program, right? So this isn't something that happens really quickly. It's something you have to kind of be diligent on. It's like a lot of standing, a lot of the vagus nerve stimulation techniques that Dr. Hrkal talks about, breathing, cold water exposure, all of that type of stuff will be helpful. But then it's so multifactorial, right? So like gut is an issue. You may want to consider seeing a functional medicine doctor to look at your hormone levels and maybe get some additional support for adrenals and those types of things, because it's so complex, right? And so if you find a good like functional medicine or naturopathic doctor that can help you with that, I think that would be helpful, because there's probably some additional things that you're not going to get with just the standard concussion fix type diet. So that might be helpful. Checking out the Levine protocol, trying to stay upright, right? Avoiding inactivity. So you don't want to be sitting for too long. You want to be, getting up and moving around periodically just to get that kind of blood flow going. But I think, so that's kind of the recommendation. Like for orthostatic hypotension, it's A, B, C, D, E, F. And this is that there. Like I can take a screenshot of this and send it to you.
I actually took a snippet as you were going through this.
Okay.
So I do.
Okay. Perfect. Yeah. And then if you're going to have any prolonged standing, they suggest like drinking a bunch of water before you have to do that, right? If you're going to be up and about, or you have to go shopping or something like that, drinking a couple 8-ounce glasses of water before you go can help just feeling better while you're out and about. Consider raising the head of the bed, right? It's just to kind of keep your body upright as much as possible, is to get used to that stimulus. But like autonomic function has to do with stress, anxiety, mental health, sleep, gut, exercise levels. Like it's so multifactorial that we kind of have to look at it very comprehensively like that.
Yeah, no, I get it. And I mean, sleep is probably the only good thing that I have in that entire list that you mentioned.
Yeah, well, that's good.
One last thing for Dr. Hrkal.
Sure.
I think you answered somebody's question on the boards in the program before, but low dose naproxen, LDN, what are your thoughts on that in terms of me and dysautonomia? Somebody, a naturopath offered that to me and I was like, I'm not sure yet.
Yeah, so we have talked about it numerous times as part of the forum, and people are asking questions about it. It's a unique medication. It's low dose naltrexone. Naltrexone, and it's a medication that has a unique mechanism of action because it's traditionally used in higher doses, at regular doses, for weaning off people that have addictions to drugs and alcohol. So it has this blocking effect on opioid receptors, and without actually stimulating them. However, at low doses, the effect slightly changes, where it actually has this really unique anti-inflammatory effect. So actually, low-dose naltrexone, from what you've described, because of its influence on modulating, which is another word for balancing the immune system, as well as balancing neuroinflammation, could actually be a really good strategy for you, considering that a lot of other things haven't worked, and you just almost like need a little bit of a leg up. And when I say low dose, we're talking like, starting at like 0.5 milligrams when regular doses are like 20 milligrams.
Mm-hmm. I think 0.5 is exactly what the doctor said too.
Yeah, start 0.5 and you work your way up to the highest dose that's effective on reducing symptoms, and that can work your way up to 1, 2, 4, 5 milligrams at the highest usually. And you need to have a doctor that's willing to prescribe it and monitor it and titrate it. So I actually think it could be a really good idea for you. Now, I will finish off by saying, anyone that's listening to this is probably saying, "Oh my gosh, this is amazing! We should all get on this stuff." Just like any medication, it doesn't work for everybody. So I will caution anybody listening to this, if they're thinking this is like the magic bullet. It's not. We know about it. We've tried it before. I've seen it work well in some patients. I've also seen it not do anything in some patients. And so, obviously trying to match that good candidate with the actual prescription is, up to the doctor. And I think we're getting better at doing that. But it's not going to be a panacea for every single post-concussion issue.
But no huge detrimental side effects that
any medication has side effects. This one particularly has very few. You know what I'm going to do is I'm going to post a website. There's a whole website dedicated to this thing called low-dose naltrexone, or LDN. So people are asking what this is. It's called the LDN Research Trust. And then there's a whole bunch of guides. There's a patient guide. So I'm just going to actually pop that into the chat so people can know a little bit more about it. Okay?
Okay. Thank you, Dr. Hrkal.
Yeah, hopefully that helps. From my side, I just want to echo what Dr. Cam was saying, and just take a look at your mindset, right? If you're feeling super discouraged, that's going to, add to things like depression, and depression is going to make us less active, and it kind of is a domino effect. So seeing whether there's any sort of protective things you can do for your mental health and your mood while you're going through this, because that's going to work wonders as well.
All right. Thank you all. Appreciate it.
You're welcome. It's a long road. So don't be like trying to, think you're going to be better next week. Like it's like I said, the Levine protocol itself is like a 6 to 8 month thing. So it's a very kind of gradual, laborious thing. But I think that implementing those over time, at least as a stopgap until you get back on that 6-month wait list, which is crazy. But, I think those are the best places to start, is trying to be comprehensive around the autonomic system.
Yeah. Okay. Thank you.
You're welcome. All right. Next up is.
Thanks for taking my question. My question is about visual tracking. So I got my concussion 2 years ago, and I've gone through the program. I've been in vision rehab. I have the prism glasses. I've seen one of your chiropractors for neck rehab. for 6 months, and I can turn my head better than I could before. But reading is like, I'm a teacher and I can't read. So it's still very hard for me. I get headaches, pressure in my head, headaches, migraines. Some days I can get the symptoms in 30 seconds, and other days or other weeks I know I can read for 10 minutes and things are great, or I can read for longer. Whatever I do read, it doesn't matter if it's on a screen or on a piece of paper. The font has to be very large regardless of how my symptoms are. Nothing becomes blurry or anything like that. It's just that I get these headaches, and to the point where I can't do my job without support. And I can't, well, there's just things that obviously, you need to read every day. So that's my challenge. And I'm on the Concussion Fix diet. I've been on it for 6 months. I've had all my hormone levels tested. I don't know where to go from here, because I feel like I've tried many different things and I'm kind of just spinning my wheels. And even when I think I'm getting better and I'm going to be reading a novel by the summer, that kind of thing, then for whatever reason, my symptoms get worse again. So it's been a roller coaster for 2 years. But the reading hasn't gotten any better. The head turning and being able to turn my head is better. It's still not normal.
So with the treatment you're getting on the neck,
Mm-hmm.
are they able to recreate those headaches when they push on things and work on things?
Yeah, like in the suboccipital area, you mean? Like he does that, and yeah, I can feel it when he puts pressure back there. I can feel it in my head for sure. Same with when I get massage, I can feel it in my head. But like I've been, every week for 6 months,
Yeah, that's
and
not. They're missing something. Are they doing anything in the front of your neck? Are they working on deep
yep,
neck flex? Yeah.
yep.
Do you feel improvement after the treatment? Like, let's say you get treatment today, are you able to read for longer for the next few days, or?
The reading, I can never figure out why. Some days I can. No, it's not linked to anything. I do believe that the head turning has improved, and that's probably because of the neck rehab. But the reading is just, I don't know, it's so hard.
Are they doing any, like the chiro you're seeing, are they doing any other rehab with you?
Oh, yeah. Yep. I could do all the vestibular therapy. I have vision therapy exercises, vestibular therapy exercises, neck exercises. Yeah. Yeah.
When's the last time you had the prisms reevaluated?
I just had the prisms never made any difference, to be honest with you. It was kind of a hopeful thing, but it didn't help. I got the prisms in my glasses in the fall, maybe November, but it never affected my ability to read or turn my head. It just didn't help me.
Are you still wearing the prisms?
Yeah, because in order to get them replaced, I have to then get another prescription, and it's very expensive.
I know.
So the prisms were very expensive and I didn't see a result from them. So now to go back, I would have to then get my lenses redone again. And I just haven't done that yet. So
Yeah, I mean, sometimes the issue is sometimes like if you get, let's say, corrective eyewear of some kind, and then you start getting neck work, that prescription is going to change over time because of the neck function. And if you don't change the prescription, then it's like you still have this mismatch, which can contribute. So it's almost like you got to kind of keep reevaluating and keep changing as you go.
I did get a reassessment. Like I see Dr. Blanc. So
Okay.
I got, I know she's one of your
Yeah, she's
neuroptometrists.
great.
She's great. So I did get a reassessment from her like a month ago or so, and maybe 5 weeks ago, and she sent me off with a program called Vision Edge. So I'm on that Vision Edge, like it's a smart program on my laptop, and she hasn't scheduled anything with me like yet, because now I'm trying this program. I don't see any results yet with this program. To be honest, I'm kind of like stumping my chiropractor, who's also been trained with complete concussion management, and the neurooptometrist. They're both kind of not knowing what to do with me. So
Who's the chiro, if you don't mind me asking?
yeah, Dr. Ash in Toronto. He's great too. Dr. Blanc referred him, and Dr. Hrkal referred him too. So
Okay. There's just, because sometimes it's just a different set of hands, to like unlock things. Like when it's been 6 months, like if you were my patient, I'd be looking to send you somewhere else because I'm missing something. You know what I mean?
yeah, he thinks that my eyes haven't caught up to my neck. I don't know if that makes sense to you, but like he sees progress in my neck. I see progress in my neck.
Yeah.
Like I do, like being able to even turn my head to cross the street. I can do that now.
Yeah.
I couldn't do that before. So I see progress there. It's just that my eyes, like it's the reading. Like my symptom score was never that high to begin with because it's really all about reading. But because you read every day,
Yeah.
I have symptoms every day. So
Can you send me a direct message on the platform?
Yep.
I'm gonna maybe recommend somebody else just to take a second look,
okay.
and see maybe there's something else, like something else to just kind of unlock and get you over this hump.
Yeah, I am willing to try anything and do anything.
Okay. The fact that he can recreate the headaches is a good sign that they're probably neck related. And like when your eyes are moving, it's going to cause the muscles in your neck to engage. And if there's dysfunction there, that then causes a reciprocal headache to happen. So it's still neck dysfunction in my opinion. Like I don't think it's the fact that your eyes haven't caught up to your neck. Usually it's just the eye motion itself is triggering something in your neck that's causing this referred pain. So it's still, in my opinion, likely to be neck dysfunction. So yeah, send me a message on the platform and I'll make some recommendations.
Okay.
Okay.
All right. Thank you.
You're welcome. Okay, next up is
Hi everyone. Can you hear me all right?
Yep.
Excellent. Okay, my question is just around vision as well, but a bit of a different scenario. I've got a grainy sort of snow issue, which I've only just realised. And I spoke with you, well, I spoke on one of these Q&A sessions a couple of weeks ago. And my question to you then was just around symptoms changing. Since then, I've been to my audiovestibular therapist, and she's helped me with the vertigo issue, which is almost solved, I think. I'm about to go see her again on Monday, and hopefully the vertigo issue is sorted out. But as we've gone through the troubleshooting, as it were, for the vertigo issue, I couldn't really describe what I was seeing. Like I was still getting blurry, stuff being blurry, and although some of the movement that I was seeing had stopped. So the issue really is I've got like a snowy vision issue, and if I've noticed, and I think I've had this for a while, when I try and read, the words don't really stay in place. They sort of move. It's not big movements, but it's enough movement to sort of make concentration really quite difficult, and you really have to strain if you want to read something, to comprehend it like you would if you're at work. That starts getting really quite taxing. So I'm going to speak with her about this on Tuesday, but she's an audiovestibular therapist. Is that the best place to speak with someone about this sort of issue, or should I be looking elsewhere?
No. I don't think it's vestibular. I think again, getting back to neck, I think it's neck. But so visual snow is one of these like newer concepts. We don't really understand why it's there. One of my theories is that it's related to kind of autonomic dysfunction. But if I go into the neck side of things, so this is neck-related vision issues that are the most common. Number one, needing to concentrate, harder to read, visual fatigue, sensitivity to light, and then this one here, you can see words moving on the page.
Okay.
That
I've had those for a long time.
So that's neck-related visual dysfunction, right? So I think that some of the symptoms you're experiencing at least are actually neck-related. So going to a vestibular person is not going to be the situation, right? Now, if you do have vestibular dysfunction, generally what happens is when you're dizzy or having vertigo, your neck will tighten up because it's trying to stabilize you. So it often results when somebody has a vestibular issue, they'll often end up with a compensatory neck issue. And the vestibular issue goes away, but they still have, now they have all these altered visual things. So that's how symptoms change, right? You're asking about symptoms starting to change and evolve over time. This is kind of how that goes. You start with a vestibular issue, you're really dizzy, so your neck tries to compensate by trying to hold you really stable, but then everything really tightens up. And then what happens is your eyes, when they move, is asking your neck where it is in space, and your neck is so jacked up that it's giving altered information to your eyes, and now you have all these kind of eye movement disorders, and you see all these kind of weird visual symptoms. It's because of the input from the neck being dysfunctional, probably as a result of the vertigo that you had. So that's why we always treat all three together, right? So it's never just vestibular, it's never just visual. It's, you want to be making sure that if you're doing vision therapy, you want to be also doing neck, and if you're doing vestibular, you also want to be treating the neck at the same time to try and keep all three systems kind of congruent and working together. So in my opinion, what you need is some really good kind of manual therapy. Now you're in the UK, so that's sometimes hard to find. Where are you actually? Where are you located?
I'm in Surrey, just south of London. We're about an hour out of central London.
Okay.
But I was seeing an osteopath just up the road from me, but I think she's kind of taken my neck as far as she can go. So I was going to speak to the autovestibular therapist. I've sort of mentioned the neck to her before to say, look, I need to sort this out. I think it's a problem, and she agrees with that. So I think her approach was to sort out the vertigo and then send me somewhere else for the neck.
Right.
So hopefully we're going to do that on Monday morning when I see her again.
Yeah, I would see if she knows anyone. Really, you want somebody who's good at manual therapy, like manipulation. You may want to look into like a chiropractor, just a different kind of approach than an osteopath maybe might be more effective. Typically, if the chiropractor is just doing adjustments, that's not what you want either. Like, you want somebody that does a little bit of like active release, soft tissue, maybe some acupuncture at the same time. And I know that it's very hard to find like an actual vision therapist in the UK, but that would be another thing to try and figure out if you can. Because some of that visual snow symptoms, sometimes they can help with different lenses, different tints, that type of thing. But I think it comes down again to like calming the nervous system. I think that's a big component of this. Similar to light sensitivity, if your nervous system is kind of on edge, you start having all these weird perceptual things. So, working on kind of calming down the nervous system and doing that autonomic stuff, I think can be helpful in this situation. But then I think a lot of that kind of words moving on the page type of situation is probably related to like neck dysfunction.
Okay, that's interesting. The visual snow, I don't know if this is important or not, but I may have had this before I had my recent incident where I got concussion. But when my first time I knocked myself out playing sport, the visual snow was really intense. It was like raining in my head. Straight up, as soon as I got up again, I could really see it and feel it. And I don't know if it's ever really properly cleared because I've never seek professional help. I've always just let it recover and just carried on. I'm not one for looking after myself, unfortunately. So the visual snow might have been around for quite a while, and it's something I've never really picked up on. But I'll get the neck checked out and then see where to go from there.
Yeah, and maybe do some Googling to see if you can find any like vision therapy or neurooptometry, that type of thing, because that's going to be more in their wheelhouse. But I think supporting the autonomic system is going to be helpful for that as well.
Yeah. I've been following the diet. I've changed my diet and doing a lot of meditation, a lot of exercise, stuff like that. Although I've just hurt my knee, so the exercise has slowed up a bit. But that's very helpful. Thank you.
You're welcome. Okay, next up is...
Hi there.
Hello.
So I don't really have a direct question, but I just kind of wanted to talk about how I'm going with my recovery and where I should go in the future. Pretty much, I've had post-concussion for 5 years now, and just lately I've been feeling a bit hopeless. Like, I feel like I've really tried everything that I can think of. I've been through like the program twice. I took work off at the around end of November last year because I finished my university studies, and I went full time into pretty much recovering. So pretty much I had a very strict set routine. Would try to do the best I could with everything, managing like my symptoms throughout the day, but focusing on like getting enough sleep, keeping to like a gluten-free, dairy-free diet, cold showers, trying to improve my exercise intolerance, getting work on my neck, yoga, just relaxing, unwinding, and trying my best to reduce my symptoms. A lot of my symptoms, I believe, are from like autonomic nervous system dysregulation. I've seen like a really big improvement from then till now with my exercise intolerance. I had like a exercise threshold, heart rate threshold of around 135 beats per minute, and I've gotten that up to pretty much my age max now, which is around 190, which is really good. And I've seen like lots of like small adjustments have made, like small positives, like the gluten-free, dairy-free diet has helped me after meals. I'm not feeling as symptomatic. The meditation, the cold showers, ice bath, they're all helping, but I'm feeling better, but I'm not better. And I'm just, at the moment, I'm just a bit down about getting better, and if it's something I really should kind of accept, that I should manage these symptoms for the rest of, well, not the rest of my life, but I need to change the mindset of I can fully get better, instead of I need to manage this and start moving on with my life.
Mm-hmm. What are the symptoms that are most problematic right now?
Headaches, fogginess are the main symptoms. So yeah, temple headaches, and fogginess and fatigue throughout the day. So after lunch around 2:00, just start kind of crashing.
Can you reproduce your headaches?
I can't reproduce them by like any like neck mobility or adjustments, but if I adjust my neck, I can bring on headaches.
Like this, kind of like cracking it back and forth like that?
Not just going back and forth, but if I actually crack my neck, if there's an adjustment, then that brings on headaches.
Is that the only time you have those headaches, when you adjust them, or is it like a daily headache?
No, they're daily headaches. They vary in intensity throughout the day, timing. It just happens.
Are you getting Are you getting neck treatment?
Yes, I've had neck treatment. I'm not at the moment. I was doing about 6 to 8 weeks of neck treatment. I've been to about 5 to 10 different physiotherapists and chiropractors throughout the 5 years. And the last lady I went to, she was really good. I went through the neck rehab videos that you've done, and I broke down the notes, sat down with her, and we really went through it. And she was like, yeah, she's happy to like apply the things from the videos. And we were applying all the exercises and treatment that you mentioned throughout those videos for about 6 to 8 weeks, but I didn't have any improvement.
Did anyone check your jaw?
Yeah, they checked my jaw. They were like massaging my jaw. My jaw was very tight.
Anyone go inside your mouth?
No.
You sound like you're in Australia.
Yeah.
Whereabouts?
In Perth.
Perth. Okay.
Western Australia.
Yeah. Yeah.
So if you crack, to me, if you crack your neck, you can reproduce it. That tells me there's still some sort of thing possibly going in your neck. Maybe it's ligamentous because you can impact ligaments and joints with subluxations. Did your physio at all, or anyone, did they ever recreate your headaches when they treated you?
They couldn't like specifically push a certain muscle and recreate it. There can be times like if I do have headaches, I can like play around with my neck, massage my neck, and I can, I guess, increase it and like feel the headache intensity like change, but I'm not really too sure if it's directly like related to it because I've really tried working hard on the neck.
Well, it sounds like it. We're not saying you're not. We're just trying to like really try to get to the bottom of what's going on. Temple headaches. There's a lot of referrals from the front of your neck, so like scalenes and SCMs, and also cervical spine. Obviously, Cam knows that this area here is quite commonly worked on, but this area is often just, most providers are not comfortable with that area. They just don't really know what they're doing there.
Have you?
I got in those with her. We were in the SEMs and the scalenes and that.
Have you gone to see Rob Nichols?
I'll have to have a look.
So they're one of our clinics.
Yeah.
They're in Perth, and the clinic name is TMJ and Headache Clinic.
Yeah, I've been to TMJ. I didn't see Rob himself. I saw a different gent, but I've been to TMJ. Can
you try to go back and book in with Rob? Just because he's done our concussion training as well, it might just be...
Yep, I can give it a crack for sure.
Just because I think in this situation, especially when you have headaches in the temple region, to me, I'm thinking TMJ. And if nobody's gone like inside, so there's two muscles that are at the back called the pterygoid muscles. And those ones are super important for like TMJ function, and they also correlate with neck issues. So for example, when I treat patients, if they have these really tight suboccipitals and they're not letting go and I'm not getting anywhere with it, then what I'll do is I'll go in and I'll work on the pterygoids a bit, and the suboccipitals will just let go. So it's one of those things where there's this reciprocal relationship between the pterygoids and neck function, and a lot of practitioners don't do that. But if you go to a clinic that's actually specialized in TMJ, which is like very rare, and this clinic is called TMJ and Headache, I'm assuming that they're going to be pretty good at treating TMJ. It just might be something to unlock it, right? So I know that you're discouraged, and I know that you've tried all these things, and sometimes it's like, 2 steps forward, 1 step back, but it's never something that you just go, well, I just gotta like learn to live with it, because that's not the case. If there's symptoms, there's a reason. It's just you haven't found the reason, or you haven't found the right person to unlock that reason. And I know that it can be discouraging and it seems like a super long road. But there's something there. Like, people don't just get headaches for no reason. There's a reason. There's a reason that's there. It's been either overlooked or not addressed sufficiently. And so, I wouldn't give up on that. Now, the other thing I do want to say is that sometimes when we go into like, okay, I'm just going to like focus on recovery and nothing else, and then you're trying to like optimize everything in your life, you just become hyper vigilant, and it tends to make people hyper fixated on their symptoms, and that can be problematic as well, right? If your whole thing is about your symptoms, then anytime a symptom increases, you start to think of, oh, this is not working, and it can kind of spiral you, and it kind of dysregulates things further. So in one way, you want to kind of, quote, move on with your life and not make it like the sole focus of your entire attention, because that will just keep things around, right? Like it just is every part of you, and you're constantly focused on it, and that can be actually problematic. Instead, what you want to do is you want to do the things, but you still want to try and live your life so that concussion is not your entire focus. So it's kind of a balance between the two things. So it's not necessarily moving on and being like, well, this is it and that's it, I'm just going to be like this forever, because that's not the case. There's something going on. We just have to find it. But on the flip side, it's trying to not think about it 100% of your day. Like, you want to just be able to kind of go about your day as much as possible without thinking about it, without focusing on it, because kind of what we focus on tends to kind of remain around, and that just increases our anxiety and stress. Melinda?
That's where I was going to go with that too, is just a sense of, we've spoken to you in the program a number of times, and we kind of know how, diligent you were about your recovery. And it sounds like you've had a lot of gains and a lot of improvement. And then just that last piece of, allowing things to be both. You can still work on improving, but you also need to live your life. Just as Dr. Cam said, he kind of took the words right out of my mouth around that. It's exactly that. We can't stop everything because we have PCS symptoms that might be lingering. It sounds like you're at a place where you can exercise. You took some time off of school, but you were able to graduate, and now you're trying to move forward. Life doesn't have to stop because you're not back to your old baseline. So that might be where this concept of like a new normal comes in. This is your new normal. So how can you live your life right now with what you're experiencing, so that you're not just sitting waiting for the rest of the symptoms to go away and committing yourself to just focusing on resolving those symptoms. So the invitation is sort of this sense of like allowing it to be both. I'm not 100%, and I'm still committed to finding out the reasons why I have these temporal headaches, but I'm also not just going to commit my whole life to focusing on that. And to Dr. Cam's point, I think it's very important to remember how neuroplasticity works. If we're constantly focusing on the symptoms, then those neural networks in the brain actually grow, they get bigger, and your symptoms will increase. The intensity, the frequency, the duration of the symptoms, they increase if we're constantly focusing on them. So there is a lot to do with that sense of mindfulness, and can I live in the present? Can I focus on things that bring me joy? Can I make sure I'm doing things that keep me balanced alongside having symptoms? Because if we're hyper focused or hyper fixated on just symptoms, that's actually going to create another spiral for us that's going to be unhelpful. So maybe this commitment of, hey, I still am going to work on these last symptoms that are persistent while I move forward and live my life as well. Of course, it's still difficult, right? Really validating that it's still difficult to live with challenging symptoms that, might cause you to have certain limitations in your life, but there's still enough life there to find that hope, enjoyment, presence, happiness in the capacity that you do have. And that might be somewhere to focus your attention.
Yeah, thank you for that.
One final thing while you do that, Cam, I might add is that if there's brain fog, I made a couple notes here as you were talking. If there's brain fog and fatigue as well, that could be because you're just in pain. But I don't know if you've had hormonal tests done. So things like growth hormone, adrenal hormones, the HPA axis can also influence that fatigue aspect. And also having brain fog that just is not responding to anything. I would say first start off with what we've talked about so far and what Dr. Cam's mentioned, and then those are additional kind of pieces that often are, last on the list for us to test because they're just hard to kind of access, but that may influence fatigue and brain fog.
Yeah, and I'm almost curious too if it's like sort of a sequential thing, right? You continue to work on the neck, focus on mood because those symptoms are also equivalent to depression, right? Brain fog, headaches, fatigue, these are all also symptomatic of depression. So it's a sense of trying to do things in a way that's going to make sense for you. So committing to the neck, remembering mindset and mood, and then, also keeping in mind these, hormonal elements that can be really important. But, this really is such an illustration of that overlapping symptomatology that we talk a lot about because it is like peeling back layers of the onion. And so foundationally, we talk a lot about mood, right? You mentioned feeling hopeless. You mentioned feeling, some of these things. So thinking, hey, am I dealing with really low mood and depression right now? Because that can also not only increase those symptoms, but depression has those symptoms as part of its diagnostic criteria. So thinking to yourself about, is my mood a part of this picture? And if not, then it could absolutely be other things. And they all are bidirectional. So it really is kind of taking a look at that whole picture.
Have you gone to therapy at all?
Yeah, I've gone like yeah. What therapy in particular are you talking about?
Like mental health, like talk therapy, CBT or something like that with a therapist to talk.
Yeah, I've been to therapy. I also tried the eye rapid movement therapy
Yeah.
to hopefully try,
That's more like
retrain.
PTSD, I think, right?
Yeah, they wanted to give it a crack to try, like kind of rewire my brain to for those headaches and those symptoms, kind of like they would with PTSD, like rewire how your brain perceives
Are you
the
still
different.
doing therapy at all?
No, I gave that a good crack. Did about 15 sessions, but I didn't see any improvement. So not doing
Okay.
any of that anymore.
Ha-
But yeah,
have you ever been assessed like for depression in terms of like outcome measures or anything like that? Like
uh,
there's questionnaires that they'll ask you and they'll kind of.
yeah. I have been assessed. Recently, I had like a really big life change. So I had like so at the moment, I wouldn't. I'm not sure if I'm depressed, but I have been down the last 3 to 4 months from the life change, and that has had a significant impact of my symptoms.
Yeah.
Um, so like just the stress and that from that I saw it directly, like it happened one day, and then ever since then symptoms skyrocketed. Um,
Right.
so and that's kind of what led me into the do I need to accept, because I was going like quite well with my recovery, was starting to make some really good progress, but then I had just like a normal, like a life setback, which we all have, and it had a significant impact on my symptoms. So
Yeah. And that's how you can see how that how the mental health piece is so important, right? Um, so I'll let Melinda share her screen here, but it may even be something talking to your doctor about, like maybe a short course of medication, maybe something to help get you out of, this, because I'm kind of detecting some of that, like Melinda is as well. Um, I think that'll be something that may unlock for you if you can do something to elevate mood, whether it's medication or even just a different therapist or something else. But and anyway, Melinda, go ahead.
Yeah, I mean, this is the hard part, right? Recognizing where some of our mindset or our mood might be limiting our recovery or actually enhancing some of the, increasing some of the symptoms you're feeling. So I know, we've talked in the program and there's this sense of having a really structured schedule for yourself. And sometimes I can speak to the fixed mindset. I don't know if do you remember going through the program and learning about the growth and the fixed mindset?
yeah,
Yeah, so I don't did you identify at all with fixed mindset?
I was more in the growth mindset mainly.
Okay. Yeah, so there's sort of that one sense of, fixed mindset can mean that we have certain expectations of how things should show up for us and how our life should be. And if they don't equate to that, then we feel like we can't move on until things meet those expectations. So that's where depression can come in. So that was kind of the picture I'm illustrating. And you just try that on for yourself and see if it fits. Of course, we're only getting this little snippet from you, and we're not your mental health provider. But you can kind of think here, this is part module in our new program in the re-record, where it talks about these features of clinical depression. So low mood occurring nearly every day, present for most of the day, and it's only for a period of 2 consecutive weeks. So like you said, there was this sort of tipping point, something happened, it aggravated things. It might have been, perhaps there was like a low level of depression before, and now it's really kind of increased. And there's certain characteristics of clinical depression that you can try on. Is there a loss of interest in some pleasurable activities, right? This feeling of emptiness, hopelessness, and persistent feelings of sadness. Not feeling enjoyment in activities that used to really bring you joy. Social withdrawal. Do I give up? I'm not caring anymore. And then there's a series of sort of feelings, emotions, cognitions, and physical sensations. Okay, so there's a range of areas that you can assess, and a mental health provider can help you to assess whether depression might be part of your clinical picture. CBT is often very effective for depression. When you get into trauma therapy, you're looking at a more complex picture, but direct CBT can be helpful for both fixed mindset and depression. And it can be this sense of, how can I shift how my thoughts are formulated so that the things that are still lacking in my life aren't holding me back. So, for example, having certain symptoms, not having all of your symptoms anymore. So, what you've shared with us and what we've already stipulated is, it sounds like there's a lot of quality of life that's come back, but there's still these remaining symptoms. So this is where we can kind of get stuck on a hamster wheel, right? I'm not 100%, but I'm really not where I want to be. And then there can be this hang up that can generate a lot of dysfunctions around our mood. So something to try on for yourself. Not to give up on therapy if you didn't have a great experience with one provider, and just that note around trauma therapy may not always be the way to go right away. You might try something like cognitive behavioral therapy first.
Yep. Thank you so very much for your time.
You're welcome. Okay, next up is...
Hi, Dr. Marshall. So I joined Concussion Fix 4 years ago. It's been 7 years post concussion, and collectively started doing well. So I guess I'll get to the point. For like a year and a half or so, last year and the year before, I was starting to feel pretty good as far as the nervous system as well. I think that's like foundation here. But bottom line is this: I've always had like visual processing issues with scrolling on the phone. It's always been challenging. When I scroll on the phone, I get fatigued, and so working has always been hard to work. I can't work more than an hour or two or at a time at a certain point. And then there was times where it's like even like 15 minutes was challenging. But again, it just collectively got better. So life was getting collectively better. But never really, what I've been in and out of different functional neurologists. Saw Dr. Hoy, who's a CCMI. Do you know who he is? He's in Irvine, California.
Not personally, no.
Okay, that's fine. Saw him, and we did the right eye. Did the right eye software, and we were doing the exercise with the right eye. He was doing neck work. When I say neck work, a little bit of massage, but then he would crack my neck. And then life was starting to feel good, and as a whole, just in general, with lack of stress, etc. So then I didn't see anybody for a year and a half. As of August of last year, I started seeing people, but before that, the year and a half. And so I was like, wow, I don't really need to think about this concussion thing anymore. I saw your stuff online. I'm like, I don't even need to go there anymore. It was great. It was a great feeling, right? And then the weirdest thing happened was I was in a restaurant in August, and I've always had an affinity or really, really light sensitivity. Light sensitivity has always been there, but it's with just the LED lights that are really poignant, like the ones that are in like grocery stores and stuff like that. They're just super, super, super like strong. So I just don't look at them. I just go on with my life. It's fine. Fluorescent lights were good at the time. Well, I was in this restaurant, and they had all these the lights where you could see the filament, the LED lights throughout the whole restaurant. I had a hat on. I didn't look at the lights because I knew that they just would my brain couldn't handle it. It was this crazy feeling. But I was in the restaurant. I was like, oh, yeah, I could do this. And after I left there, my system, it was almost like my nervous system, I had light sensitivity from then on. And I was like, wow, it's hardly even watch TV again. I didn't watch TV for 3 to 4 years when, after the incident itself, the injury. So I'm going back. But again, my system was getting used to everything, right? So now I'm here, I've got this regression. Like, what the heck? So then I went, let's see, my son, like a month later, my son ran into me, like with his forehead on my upper lip, like slammed into me. And I was like, whoa, and I got so pissed. I was like thinking I'm going to regress. And I was like, I was trying to like psychologically just calm myself down, did okay with that. But then a few weeks later, went to Las Vegas for his baseball tournament. And the lights were just crazy. And from then on, now I can't even drive at night. It's nuts. So again, I think of the psychological and the physical aspect of all this, right? Psych is a nervous system dysfunction due to, spurring this light sensitive. So again, my system, I'm back to where it's been horrible. Like stress wise, anxiety has been through the roof. When I'm back on medication, so now it's subsided as far as the stress, but I still have light sensitivity and sound sensitivity. When I got the light sensitivity, the sound sensitivity just happened on itself too. So again, I'm sorry I'm going around in circles with all that stuff, but I've always had this visual processing issue too with the scrolling on the phone. It's always been a problem. Creates fatigue. I'm back at Dr. Hoy right now. We're doing neck work. Now I told him not to crack my neck because he cracked my neck after I hit my son. My son knocked into me. He cracked my neck, and then something spurred. I had super bad pain. I didn't go for a month, but now I'm back at him again because I'm just saying, let's just do massage. We're doing massage work, and I'm doing a lot of more eye exercises that I was doing in the past. So that's where I'm at.
Yeah. Have you seen the concussion cliff video that I made?
Yeah, that's to the T.
Right.
To the T. Like, I'm so pissed. I mean, seriously, guys, 7 years post, it's like been through the ringer with all this stuff.
Yeah.
With the psych, with everything, with going to I spent $130,000 cash. And now, I'll just tell you too, again, I think this will just prove the point. Yes, last year, a lot of stress with money. Business was low. Hard to work, well, again, the visual thing's always been there, but just always persevere, always just keep my head up and going. But again, do the economy, work, stress, money caught up to me. And yeah, it's been stressful. So stress, yeah, sure. Is stress doing this to me?
Yeah.
You know what I'm saying?
Yes,
It can.
I mean, but the light sensitivity is crazy though. I cannot even look at these even in the daytime when a car puts on his lights, it's just piercing. Before, it was no worries. And I never had this before this whole 7 years. It's like exasperated. And now I've got lights. Now I've got like sound sensitive exasperated. I'm trying to talk fast because I won't tell you, but like I was this past weekend, there was a few things that happened. There was super loud sounds, and now my sound sensitivity is worse. And I've got this, I've got a little bit of tinnitus. It's just driving me effing crazy.
Yeah, your nervous system's just totally on overdrive, right? So when we experience stress that lasts for a little while, it kind of dysregulates everything, right? It dysregulates your nervous system. That dysregulated nervous system is going to cause inflammation. The inflammation is going to create more vulnerability to have your symptoms return from PCS. It's a whole cycle. It's that domino effect, right? So absolutely, right? I think you.
So, I mean, like Melinda's saying, it's how everything kind of compounds, right? So, everything's going well. You're basically up on top of the concussion cliff. Things are going really well. You're able to tolerate most things, but then one event, and it's probably just the straw that broke the camel's back, right? It wasn't necessarily sitting in the restaurant. but it was sitting in the restaurant in addition to financial stress, worry, all this other stuff compounding, like your body's just gradually, this is all burning below the surface, right? It's kind of subclinical dysfunction where it's not necessarily manifesting yet, but it's just kind of, it's pushing you towards the edge of that cliff. And then there's one trigger that kind of throws you off. The kid bumps you into you, boom, that it just dysregulates further. And now there's anxiety about that situation, which is going to increase your nervous system dysregulation, right? You're going to go more into sympathetic, which is your fight flight. What does your sympathetic nervous system do? Well, it increases the diameter of your pupils to let more light in, right? The bear is chasing you. You need to take in more sound, more light. That's fine when the bear is chasing you, but when you're just sitting there in a resting state and your pupils are trying to take in light because your nervous system is sensing danger, that's going to appear as light sensitivity. That's going to appear as noise sensitivity. So it's like we need to kind of go back to basics to like de-stress, calm the nervous system, right? Your neck will also increase in tension when all this stress is going on. So then that will start to cause various symptoms. And a lot of perceptual issues are either vision related or neck related. So there could be some neck things there. Now, in terms of like avoiding the cracking because you had like, an adjustment that increased pain, a lot of people make that mistake, right? That I tend to think of that as a mistake because there's probably still dysfunction there. And like you do one adjustment, you go a little bit too hard and it increases symptoms and people go, well, I'm not doing that again. Well, no, that's just, it's kind of, playing with things a little bit. So I wouldn't be so hesitant to do that because there could be some joint dysfunction that is there still. So don't be too freaked out. Like I always tell this story of a patient that came in after 15 years of dizziness. And the dizziness started after a chiropractic manipulation. But if she would have just went back the next week, they would have just fixed their error and it would have been done. And that's it. But instead, she lived with it for 15 years. She came to see me. She's like, don't crack my neck, whatever you do. So I just started doing soft tissue. And finally, after the third visit, I'm like, you need this adjusted. Otherwise, it's going to linger. So finally, she's like, hey, do it. I adjusted her. Dizziness goes away. So 15 years, she's been avoiding this because the adjustment caused the dizziness. So she's afraid of the adjustment, but really all that had to be done was for it to be corrected the other way and game over, right? So don't be too afraid of that. But you make your own decisions on that. I'm just saying that, one adjustment that throws things off is completely normal. Don't be too hesitant about it. But I think it's just like, in terms of advice, like going back to what got you there in the first place. Right? It sounds like you're still kind of spiraling, trying to figure out what's going on. There's a lot going on. It's like, have you gone back and just like restarted the program? Just start it over as if fresh.
Which I joined 2 weeks ago. Here we are. Absolutely.
Okay.
Yeah.
Okay.
And I'm like, again, nothing against, I love you guys. But I was like so happy that I wasn't going to have to address it anymore. You know what I'm saying? But then again, I still had this foundational stuff of where I couldn't work long. It was a fatigue, like scrolling on the phone or on the computer, working brain work, even talking on the phone because I'm in sales and stuff. It's challenging, and I was still having fatigue, and sometimes more than others in my life. I don't know, due to obviously stressors. It does exacerbate everything in my life. Everything, I get it, but there's a foundation that's still there.
You may not ever be able to find the why on that. And I think if we're still asking that question, it's a good question to ask, but at some point it becomes counterproductive to get stuck on that. Mm-hmm. Where it's like, oh, why?
But I'm sorry if you don't mind me interjecting. I agree. It's like, handle my mental health, handle stress. We're a fix-it people. We want to fit like the way we do. I agree. And I'm just praying that there's just continue to be more answers to not have to regress again. I don't know.
Yeah, I really understand, and I tend to frame it to clients like we just did with a previous question, which is, can you live with both? Right? You're committed to finding the answer to that, but you're going to live anyways, and you're going to engage with life anyways. So the more we fixate on finding the why, or we get really hypervigilant when that symptom flares up, we're actually doing ourselves a disservice. We're probably going to make things worse with that mentality. So the sense is yes, it's important to find the underlying reason for that. To Dr. Paul's point, you may never, but you can still keep working on it and maintain that hopefulness that absolutely, right? A lot of people live with limitations and still have a very full and meaningful life. That's not to say you're never going to get to the bottom of this, right? Nobody knows that answer. So absolutely you can keep trying, but don't let the symptom or that vulnerability stop you from living, right? And there's things you can do right now to help you come back in your window of tolerance and really minimize the intensity, frequency, duration of those symptoms while you keep looking for the answer.
And I appreciate that. So this light sensitivity, that sound sensitivity, do you think it's nervous system based purely? I mean, what else can it be, right? I mean,
yeah, we're all nodding. Of course, there might be an underlying issue, and we're not trying to invalidate that. Absolutely, there could be, but the heightened level that you're experiencing at is when our nervous system goes into a state of panic and thinks we're in danger when we're not.
I don't feel safe in my body. You're right. I just don't. And I'm trying to get back to that. Yeah.
Go back to recovery mindset, focus on the nervous system regulation, which is right now is under the mindfulness section.
The one thing, just as we wrap this up, keep an open mind when you're, as they were sharing about, right, bringing the nervous system back into regulation. I've shared my story a lot of times of I used to do mindfulness meditation. I used to teach it to children in schools, everything. And when I went through Melinda's section, I zipped through it with this attitude of, I know this, I got this, I already do this, I teach it myself. And I didn't see any improvements because that was my mentality. And as soon as I got to the end and I knew my symptoms, because I had extreme light sensitivity also along with sound, screens, I couldn't do anything. I lived sunglasses, hats, it all. And I knew my symptoms should have decreased with Melinda's section, and it didn't. And so that's when I knew I missed something. I didn't take it seriously how I should have. And so I literally went back to the beginning. I took off my teacher hat, put on my student glasses, and I said, I'm going to pretend like I know absolutely nothing about mindfulness meditation. You know, even as a trained counselor myself, I took it off as if I knew nothing about absolutely anything. And as soon as I did that and I went through a section, that's when I had a huge first shift in my symptoms where they came down almost 50%. When we have these glasses on of we know this, or this is what it's going to be, or why, this doesn't make sense, we're not open to it, then we're not going to be open to it. So I would just come at it again with an open heart and open mind and just try it again. But we do need to wrap up. So that'll kind of be our final words for today's session. So thank you everyone for coming on today's session. We absolutely appreciate it. We love answering questions. I hope everyone has a fantastic day. Bye.
See you later, everyone. Have a great day.
Thanks for joining us. See ya.
Thanks, guys. Bye. Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.